If you look over the last 2 years, we have populations that have built up immunity. You have a virus that's continuing to make shifts. But I think what we're going to settle into is more of an endemic environment with respect to coronaviruses and the COVID virus specifically. That will mean we will have sporadic outbreaks. We will have populations at risk that need to continue to be vaccinated. But I would expect, as it's been the case with other coronaviruses over the last centuries, that the human populations will adapt and will come to, I think, a kind of resolution with this virus. I think what's really important now is we turn our attention to pandemic preparedness for the future. I'm not sure we've learned the lessons of the past, that we need to invest in R&D, we need to invest in warm preparedness to be ready for the next pandemic. And I think that should be on the global agenda.
We're all watching the Chinese reopening with great interest. Some governments have decided to take a tough line on the entry of Chinese citizens into their country. Does that make pharmacological sense, given that we were told we all need to just live alongside this thing?
I think from an epidemiological standpoint, you could certainly call it into question, because in the end, as we've learned the hard way, these viruses will move regardless, and they don't really pay attention to national borders. So I think it's probably a reaction to a concern about if there was a very rare variant that emerged, and you wouldn't want that very rare variant to be spread too quickly. But I continue to believe open borders and open economies are the right solution for the global order.
You mentioned that governments aren't preparing for the next pandemic as well. I find that staggering, despite everything we've heard and protestations from politicians over the last couple of years during COVID as well. We won't be blindsided by this again. We will be ready. We're going to put all the money into the research that is needed, into those new technologies, mRNA, etc., etc. What's the message you're giving to those politicians? I mean, you find it very hard to talk to them when they say things like that.
You know, when you think about pandemic preparedness, it's preparing for a tail risk, something that may or may not happen, and to have governments understand that in general, pandemic markets are kind of a market failure. Without government supporting it, industry can invest in something where there's no surety of a market at the end. We don't know if there's going to be a market at the end if we prepare for all of these years. So you need governments to step in. I think in an environment where inflation, of course, is hitting global economies, you have all of the fiscal strain, immediately there's retrenchment on health investment. And then if you look at the list, pandemic is pretty low down the list. And so you see the retrenchment investment.
All right, OK, let's go with this. If the governments don't want to support you financially in this way as well, make it easier to do business, make it easier to find new drugs, give you kind of some form of, I don't know, scheme where you can actually invest in research and development as well, and you can do it yourselves. I presume Europe is moving ahead now and helping companies like yourself to do this.
Yeah, no, I wouldn't say that's the case at the moment. I mean, in general, I would say, moving beyond the pandemic, I think with respect to Europe, we really have to create a much stronger innovation ecosystem. I think right now, when you look at the global places, the places around the world we can invest and put our research and development dollars and our infrastructure dollars, we want to be in places where IP is protected, where talent can move freely, where there's relatively fairly regulated environments, where there's markets that will pay a premium for innovation. And I think in many respects, Europe is falling behind. I think the European Commission has to take it very seriously that it's not a given that high innovation R&D oriented industries will remain in Europe for the long run.
So where does that leave us then in the whole area of introducing more technology into medical diagnosis and treatment? Because I think the promise here in Davos for years has been that we're going to use big data and we're going to use AI to get to better outcomes for patients.
Interestingly, over the last 5 years, we've had an incredible renaissance in research and development in our sector. First, when you look at gene and cell therapies, we have these now on the market. They're curing patients or nearly curing patients, staggering really results. We have all of this world of RNA therapeutics, not just for COVID vaccines, actually for cardiovascular disease, for liver diseases, really opening up whole new areas of medicine, radioligand therapies for cancer. And now what we learn in Davos is that generative AI could really speed up drug discovery. Now, what we need, though, is healthcare systems to say we're going to create the space to invest in these innovations. I think create more productivity in the healthcare system. Unfortunately, the first target is always the pharmaceutical industry whenever we have fiscal crunches. But in general, we're less than 15% or less than 10% of the spend. What we need to do is also use AI to make healthcare systems much, much more efficient, that 80% of spend that's not getting more efficient. So let's hope that AI can make that happen.